Hi, I'm David Bromstad. You're about to hear people talk about a subject that is very important for you and your loved ones. This is information we all need to know.
This is about a public health issue we all need to know about: HIV and AIDS. It's not in the headlines the way it was many years ago. In the past, the news was often frightening. Nowadays, reports are much more encouraging. The death rate from AIDS has dropped, but we still should be protecting ourselves because the disease continues to spread. This program will explain the simple facts about HIV everyone needs to know. You'll hear from healthcare experts and from people with HIV who are living full, active lives. You'll also hear from a role model for healthy living, the talented, high-energy design show host David Bromstad.
Taking responsibility for your health is very important. It's really important because if you have a healthy body, you're going to have a healthy mind, you're going to have a healthy life.
David Bromstad is a television personality who makes a big, bold difference in people's lives. His fans love his signature interior design style, filled with color, fun, and fantasy. He's been creating art since he was a child growing up in Minnesota.
I was always doodling, I was always coloring, but I thought every kid was coloring and doodling. But it turns out that mine went a little deeper, and I took every art course that I possibly could.
Art school brought David to Florida. After college, he worked for Disney. That led to a job designing children's rooms. Then came an amazing opportunity.
One of the interior designers that I was working for, she said, HGTV is doing this big contest. You gotta try out, your rooms are great, you have a great personality, you're gorgeous, do it. And I was like, oh, why not?
David won the competition and a show of his own. The transformation in his life is as dramatic as the makeovers he creates on TV. His interior design program is a big hit, and he spends a lot of time in the spotlight.
I travel a lot, I do a lot of designing, I'm doing a lot of different shows. It's an exciting life, but it's pretty draining at the same time. God has blessed me, but I'm definitely working for it.
But even with his busy schedule, David finds time to take care of his health. That includes learning what he needs to know about HIV.
I think it's really important for people to learn about HIV because a lot of people are afraid of it. But if you're afraid of something, you need to be educated. So education is key, whether you're affected by it immediately or whether you know somebody who is affected.
How important has that been to you about knowing that you are HIV positive?
For Gary, educating people about HIV is a full-time job. He brings a special point of view because he has HIV himself. He's one of the people sharing his story for this program.
We're all in this together. So whether you're infected, affected, or at risk, we're all in this together.
The good news about living with HIV in this day and age in the United States is that it is treatable, it is controllable.
HIV stands for Human Immunodeficiency Virus.
It is a virus that infects a person's immune system.
And the immune system is the system that we all have to protect us against infections. And it consists of a lot of different cells, white cells. And the HIV affects a group of those white cells. So when the HIV infection persists for a significant amount of time, the immune system becomes very weak.
HIV is not like cold or flu viruses that make you feel sick soon after you're infected. The HIV virus can hide inside the body, damaging your immune system while you feel fine.
One of the difficult things about HIV is that you can carry it for 10, 12, maybe even 15 years and not feel sick.
That's why many people who are infected don't know it. HIV can affect everyone: men, women, gay, straight, young, or old. For example, according to the Centers for Disease Control, 1 of every 4 new HIV infections occurs in a woman. and 1 of every 3 new infections is the result of straight sex between a man and woman.
Unfortunately, there are stigmas associated with the disease, and there are some people that believe that HIV infection is only a disease that can occur, for example, in men that have sex with men. When in reality, this is a disease that really doesn't discriminate among sexual preferences.
This is an equal opportunity virus. All it takes is 2 people having sex without protection, one with it, one without it. The one without it is at risk.
Learning if you are carrying the virus is called knowing your status. If you have the HIV virus in your body, you are HIV positive. If not, you're HIV negative. Dawn had learned a little bit about HIV during high school health classes, but she had not realized she herself was at risk.
I never knew that it was even for the straight community. I just thought it was a gay disease or people who use drugs.
So it was a shock when her fiancé disclosed his status shortly before their wedding day.
A week before I got married, my husband now told me he was HIV positive. After we got married, I went and go ahead and got tested, and it came out positive, of course.
But Dawn and her husband went on to build a strong family life. She became an advocate for people with HIV.
I'm coming to find out there is a lot of people here that have it, and they're scared to talk about it. And I don't feel like you should have to be scared to talk about it.
Dr. Donna Sweet has been helping people talk about HIV for almost 3 decades. She has seen many advances in the treatment of the virus, but she and other healthcare professionals continue to confront a lot of misinformation about the way HIV is spread.
Unfortunately, there are still people who believe you can get it by just being next to somebody, by sitting on the wrong bathroom stool, by eating after somebody.
When in reality, you cannot get HIV from a toilet seat, by sharing a glass of water and utensil, by just daily normal routine, hugging and even kissing a relative. HIV doesn't get spread that way.
This is spread by sex and by blood.
For HIV to spread from one person to another, the virus must be passed directly through some type of body fluid, such as blood, semen, or vaginal secretions.
The most common way in which HIV is spread is by unprotected sexual intercourse. So in a sense, people that are having sex without a condom.
Intercourse, be it vaginal or anal, is the most common way that it's spread. But I tell women in this country, it's important to realize that most women got it from a man through what everybody would consider standard sex. It's nothing exotic.
HIV also can be spread through sharing needles used for the injection of drugs.
HIV can also be transmitted from a mother to a child during pregnancy, and that's what is important, that during pregnancy women get tested, because there are measures that can be taken to prevent that transmission to occur from the mother to the child.
The American College of Physicians recommends that screening for HIV should be a regular part of medical care for all adults and adolescents. If you're at risk for HIV, you should talk to your healthcare professional about getting tested.
Everybody should be tested, no matter if you're male or you're female, no matter what race you are, no matter what religion. If you're having sex, get tested.
If you are not aware you have HIV, you might unknowingly spread it to others, including loved ones. Also, if you don't know you have HIV, you cannot take advantage of the medicines that may help you stay healthy.
The good news about HIV today, in comparison to many years ago, is that it's a controllable disease.
HIV and AIDS are often used in the same sentence, and yes, they are related, but they're not the same thing.
AIDS stands for Acquired Immune Deficiency Syndrome. It is the disease that is caused by the HIV virus.
What is happening is that when HIV is left untreated and the infection continues to progress, then the immune system weakens significantly, and at that time the immune system is not able to protect the body anymore.
Having AIDS means the virus has seriously damaged the cells that protect you from infections and disease. In the past, people who were HIV positive almost always developed AIDS. Now, however, medicines may prevent or delay the development of AIDS, and even people who do develop AIDS may live longer, healthier lives with the help of medicines. That's why it's so important to find out if you're infected with HIV, even if you don't think you're at risk, so you can get the treatment you need.
We need to get people to understand it's their right to have a test and they should ask about it.
Gary has been HIV positive for more than 16 years, but like many people with the virus, he has not developed AIDS. He's taking medication and precautions to help protect his immune system.
I personally have a lot of friends who are HIV positive, and they are living beautiful lives, healthy, successful, and rich lives. They have boyfriends, they have girlfriends, they are enjoying life just like everybody else.
It is important that we try to prevent HIV. I mean, HIV is a controllable disease, but it's not curable. So we need to try to prevent it. People that get infected with HIV, many times they don't know that they have the infection, so the infection continues to progress and they can become ill. In the meantime, they can infect other people.
Preventing HIV infection begins with awareness. People need to understand the facts about how the disease is spread.
The myths of HIV, I mean, way back when it first came out, I remember, sharing toothbrushes or getting it from mosquitoes and kissing, and it's just like, no, it's a sexually transmitted disease.
You can avoid HIV by not having unprotected sexual intercourse. You can protect yourself by using latex condoms during sex.
You have to protect yourself sexually. You have to presume that anyone that you're having sex with, at least until you get to know them awfully well, is infected.
No method is 100% effective, but you can greatly reduce your risk of acquiring HIV by using a male condom or other barrier method, such as a female condom or dental dam, every time you have sex. With either type of condom, it's best if you use a water-based lubricant. Another way to avoid HIV is not sharing needles with anyone for drug use.
Not that I would want anybody to do that, but get clean needles, get to a prevention program that'll give you exchange needles. Just don't share them with somebody else.
Because HIV can hide in the body for a long time, the only way to know you are infected is to get tested. Derek had been feeling perfectly healthy when he volunteered to donate blood.
My company had a blood drive, and about 2 weeks later the Red Cross called and said that the blood test had come back with some issues and that they suggested I get tested. And I cried for probably 20 to 30 minutes before I picked myself up and said, okay, let's do this.
Looking back, Derek realized he had put himself at risk, but people who know they're at risk are not the only ones who should ask about an HIV test.
It is important to recognize that even people that do not perceive themselves as being at risk need to be tested.
Hi, they just called me outside. Are you here waiting for the CTR test?
Yes, I am.
As we have mentioned, the American College of Physicians recommends that adults and adolescents be screened for HIV as part of normal medical care. During your next visit, ask your healthcare professional if you should get tested. You should be tested if you are having or have had unprotected sex, especially with different partners, or use injectable drugs. But even if you're in a long-term relationship, you should ask about getting tested.
You cannot presume just because it is a long-term relationship that it's always monogamous. And if there's ever a question, I oftentimes test couples that I see in my general medicine practice. I'll offer them both a test at the same time.
You just take it like this. You're going to put it in.
There are two types of tests for HIV. One uses a sample of saliva from the mouth or urine. The other uses a sample of blood.
An HIV test is a private test, and nobody needs to know that you're getting an HIV test.
There is a home test kit approved by the FDA. You don't get instant results because the sample must be mailed into a laboratory. No matter what kind of test is used, if a test is positive, a second test by a healthcare provider should be performed to confirm the result. You can get test results quickly, but here's an important point. The results might not reflect your most recent risky activity. There is a period after becoming infected with the HIV virus when the HIV test is negative. This period of time may last 4 to 6 months before the test becomes positive for HIV.
I'm glad I know my status, and I hope that anyone out there would be glad to know their status as well, and especially if they're negative, be proud of that. But if they are positive, such as myself, making sure that others are aware is always a good thing, because to me it is important to try and stop the disease from spreading.
The importance of getting tested, of course, is to know your status. To know our status, it makes you comfortable to be able to go out and love who you want to love, and know that you don't have something hiding within you that may hurt someone else or harm someone else.
It's really important for people to be tested because, one, you don't want to spread it to anybody else, and two, it's a manageable disease.
Because Derek knows his status, his HIV is under control. He sees his doctor on a regular basis to check on what's called his viral load, the amount of HIV in his blood, so he knows if his treatment is working.
The viral load for the HIV was almost undetectable, because of the medication.
If the test is positive, in addition to getting the medical care you need, you can take steps to avoid giving the virus to others, including loved ones. If you are pregnant, you can use treatments that may reduce the chance that your baby will have HIV. Dawn already had one healthy son from a previous marriage. After testing positive for HIV, she became pregnant with her second child. Working with her doctors, Dawn got the treatment she needed. So although both she and her husband are HIV positive, their son is not.
My youngest son, he's a product of 2 people positive, and he's negative. And he's 10 now, and he's healthy.
You can be tested by your doctor or other healthcare provider. If you don't know of a place to get tested, you can find a testing center using an online service run by the Centers for Disease Control and Prevention. Simply go to hivtest.org and type in your zip code.
One of my best friends who had tested HIV positive, and he told me, and it was kind of like, okay, now what? What's the next step to getting you healthy? And that's how we went about it.
One of the first things you can do about being HIV positive is ask for help. You might start by asking if your healthcare provider has experience treating patients with HIV.
It is okay to ask your provider if they feel comfortable about treating HIV, and if they have experience treating HIV, they have other HIV patients in their practice. It's okay to ask that question.
It's fair to find someone that can comfortably and honestly work with you and answer your questions, because there's some questions that people need answered. So not everybody is attuned to how do you prevent sexual spread? How do you use a condom? Many people have never used a condom, and it's not something that, it's not a skill you're born with, and it's fair to say, can somebody show me how to do this right?
If you don't have a healthcare provider, you can call the National HIV/AIDS Hotline for help, 800-232-4636. This line, run by the CDC, is open round the clock in English and Spanish.
The best thing is making sure you go ahead and get primary care provider, a doctor, start to take your medications if need so be it, and just make sure that you do all the necessary things to stay healthy.
Gary's story is an example of how you might need to be proactive about asking for help. When he first tested HIV positive, he felt shocked and alone.
I was like totally dumbfounded, and they read me my results and let me go, not knowing if I was in my right frame of mind or anything.
Fortunately, Gary found his way to an agency where he was treated with compassion. He says everyone should ask for the kind of help he received.
You should be respected, you should be understood, and know that it all starts with your attitude and what you believe in yourself.
There are many treatment options that can help you manage HIV, so it's important you have a healthcare team you feel comfortable talking to help you make decisions about your care.
They're not there to judge. They can't tell anybody. But it's really a great thing to have that open communication with them so they can help you out in the best way possible. And once you find that doctor, then it's great.
And remember, good communication goes in both directions. For example, if you're having trouble following your treatment plan, your healthcare team needs to know so they can help you get back on track.
The point here is that you don't want to tell the provider, the medical provider, what they want to hear. You want to tell them the truth. Having good communication with your medical provider is essential.
Regardless of whatever comes your way, you know that we have each other.
If you or a loved one has HIV, you might find it helpful to join a support group where you can talk about it, like this one, which Gary runs. Organizations devoted to HIV and AIDS often provide groups where people share information and encouragement.
They're able to come and open up and feel free to get the information that they need to live longer, healthier lives.
You also need to talk about being HIV positive with your spouse or partner. If this is a concern, ask your healthcare provider for help. Dawn acknowledges she was devastated when she first learned her husband-to-be was HIV positive, but they worked through it together.
I loved him before I found out, and I still love him now. And we're dealing with it together, and we're making each other stronger for it. And I think us dealing with it together is just a good thing.
It's true for Derek as well. Support begins at home.
My partner, he's always want to make sure that I'm doing right, and he's also one of the biggest supporters I have, and making sure that I'm taking care of myself.
Over the past 5 years, Derek has become comfortable talking about his status, not only with loved ones, but with people who might need the information he can share.
When I was first diagnosed, the doctor said, no pun intended, but if you take this and run with it, you can actually turn this into a positive experience. And I've actually kind of done that. When I talk to people just in general, like friends and family and coworkers, it's helped me try to educate them on things that they may not have known. I actually encourage people to get tested, just so that they know where they're at.
Here's advice that bears repeating. If you are HIV positive, you need to be safe. That means always using condoms if you have sexual intercourse.
People have to realize that everybody that you sleep with, you're sleeping with everybody that they slept with. So if you don't know their history, the best thing I can tell you is to wrap it up at all times.
Safety also means being careful not to come into contact with infected blood. That's why needles should never be shared.
If you're HIV positive, I think that the most important measure that you can take to keep yourself healthy is, number one, continue to follow up with your doctor and follow their instruction. Take the medications as directed.
Being HIV positive means it's more important than ever to take good care of your health. That means getting regular checkups, eating a healthy diet, getting enough sleep, and making exercise a part of your life. David Bromstad does not have HIV, but he makes sure to protect his health with good nutrition, frequent exercise, and regular checkups.
What motivates me to be healthy is a good sense of self and a self-esteem that comes from just feeling good about yourself physically. When you feel good about yourself from the inside, you project that to others on the outside.
As we have heard, many people with HIV are living full lives, but being HIV positive is a serious medical condition. To manage it, you need to get educated. Talk to your doctor or healthcare provider, go online, and learn all you can about how to stay healthy and prevent spreading the virus to others.
If you're unsure about something, about HIV or any sort of disease, ask the questions. Your doctors are there to help. Do a little Google search. Educate yourself. Really really understand what's happening with your body if you find out if you're HIV positive, or your best friend is, or your wife, or somebody, your husband. The more educated you are, the more you can help somebody else, including yourself.
Thank you.
By learning more about HIV and HIV testing, you've taken the first steps toward protecting yourself and those you love from this serious virus. As you've seen, people with HIV can live busy, full lives.
I actually have a message that I live by in regards to my diagnosis, is that I have HIV and HIV does not have me.
My attitude towards HIV is that I'm living with it. I live every day with it, but I don't think about it every day. The only time I ever think about it is maybe when I take my medicines. I go to work, I eat, I take care of my kids, I dress myself, I feed myself, you know. I live a happy life.
Keep in mind that there are resources right in your community to help you get the medication and support you need.
We have to stand one person at a time, helping many one by one until the spread of HIV and AIDS comes to a halt.
Take good care of your health. Get regular checkups. Follow your treatment plan. Be safe. And take action to protect yourself and your loved ones.
You need to get tested. You need to know your status. If you're negative, great. Take care of yourself. If you're positive, great. Take care of yourself.